From CareCredit, it's Care Experts, a podcast where we dive deep into the health and pet care industry with the professionals that make it happen. I'm Antonio Diaz, and this is Logan. This episode is brought to you in partnership with Pumpkin Pet Insurance, helping make pet wellness a walk in the park. We all want our pets to stay active, energetic, and pain-free. As pets get older, it's not uncommon to see changes like slowing down on walks or hesitating before jumping on the couch. While those signs can be subtle, they may be early indicators of common joint issues like arthritis or CCL injuries. Today, we're joined by Dr. Courtney Campbell, board-certified veterinary surgeon and founder of Stitches, a veterinary surgery center in Long Beach, California. In this episode, Dr. Campbell will help us understand what's really going on with these conditions, how to recognize early signs, and what pet parents can do from treatment options to everyday prevention. Dr. Campbell, I'm so grateful to have you here. You are a board-certified veterinary surgeon. I would love to hear about how you got into that. How'd you start, and what made that become your passion?
Well, thanks for having this conversation with me. It's something, to be honest, that I've been looking forward to all week long. So this is
Likewise.
Great to chat with you. Veterinary surgery is, I think, a manifestation of where it all started, right? I'm just a kid who grew up in Burlington, Connecticut, in the woods. All right. If I said I was bored, my parents would just be like, go outside, right?
Yeah.
So I spent most of my time like out in the woods being raised by wolves, black bears, skunks, opossums,
No
right?
way.
That's why I have horrible personality, but no. But yeah, that's where I was. And so now as a board certified veterinary surgeon, I get to explore and make that reality that I had as a dream as a kid. I get to make that a reality, and then also parlay that into being a medical correspondent, where I get to take complicated medical information and distill it down into bite-sized chunks. So it's just, for me, that having that ability to go back and forth between the OR and media works out fantastic.
I love that.
Now I love watching wildlife documentaries, because it reminds me of like growing up as a kid, as my dad, like we'd sit down together and watch wildlife documentaries. So it just all full circle. It's an amazing experience.
Yeah, I love that. Let's jump into the topic.
Okay.
We are here to talk about the difference between arthritis and CCL. So
Sure.
I know that a lot of people would probably conflate the two, especially if they see their pets walking around with a little limp or something like that. So can you explain the difference between arthritis and a CCL injury?
Absolutely. You are right. It is a visual change, right? If your dog has arthritis or your dog has a CCL or cranial cruciate ligament tear, to differentiate between the two is key. And arthritis is a global joint dysfunction. Things are not working. If you think about the joint like a car, the engine isn't working, the carburetor isn't working, the exhaust isn't working, things are breaking down inside the joint. And there's so many things inside the joint that are important to make sure they're working. The cartilage, the fluid in there, whether the joint is gliding, right? Whether there's a ligament inside the joint that's torn, right? Causing all of that inflammation and tearing. So a lot of people probably think of the joint as just two bones together. But I want people to change that mentality and think of it like an organ, like anything else, the liver, the kidneys, the heart, because the joint has its own environment. Okay. Now we shift over to CCL. Now you hear CCL, you go cranial cruciate ligament. Nothing about that sounds familiar. But the reality is, it's almost exactly the same as the ACL in humans, which stands for anterior cruciate ligament, just a different terminology.
Okay.
So the CCL in dogs is essentially the exact same thing as the ACL in humans. Here's the difference, though. Cranial cruciate ligament injury, or CCL injury in dogs, is the most common orthopedic injury we see as surgeons, right?
Oh.
So if you've got a pit bull out there, right? If you've got a lab or a golden, if you're giving your golden retriever a belly rub right now, the reality is at some point in their life, they could experience a CCL rupture or a CCL injury. And that's something that is important to know. Now, what's beautiful is so many people are adopting dogs that have a variety of pedigrees, right? Like basically you got to do your 23andMe for dogs, right? Figuring out what's in there. So it doesn't actually matter what breed you have at home. Okay. Any dog has the potential for a cranial cruciate ligament injury.
You mentioned before, like ACL is kind of what we refer to in humans and CCL for dogs. I've heard plenty of clients tell me how their dog had an ACL injury. Is that just the vet simplifying it for them so that they can understand it better? Because
Yeah, you're exactly right. You
Okay.
want to use something that's familiar. And so
see.
if you hear on the news, oh, you know, this basketball player ended up with an ACL injury, right? Then you say, oh, what's the ACL? And I start using the word cranial cruciate. Immediately your eyes gloss over. You're like, okay, blah, blah,
Yeah,
blah. This
lost
doctor's
me.
talking about, you lost me with the word cranial. But if I say ACL, you say, well, I've heard of that, right? Or I've watched SportsCenter and I see that on the bottom ticker as it's scrolling across. This athlete is out for 8 weeks because he has an ACL injury. You go, oh, that makes it sound familiar. But the nature of the injury is a little bit different. So in humans, there's usually a twisting going on, right? I want to go to the right. My ski wants to go to the left. Okay. Twist my knee. Or I want to go to the right. The soccer ball's to the left.
Yeah.
Twist my knee. ACL tear. In dogs, it's genetics.
So, as far as the need for surgery,
Yes.
when I found out that my Shepherd Brooklyn had a CCL tear, I was like, they told me like surgery is an option. It's going to cost like $5,000 to $7,000,
Right.
and which I'm happy to spend to make sure that she's healthy.
Sure.
But at the same time, you know, I think to myself, is it necessary? How do we know if surgery is absolutely necessary for something like a CCL tear? Is it something that can heal on its own, or is it like, nope, we need surgery?
You know, the reality is this is really tough for a lot of pet parents because it's the most common injury in dogs. A lot of times you hear different advice,
Yeah.
right? You hear advice coming from a variety of doctors. And also, let's be honest, if your dog's limping and you're speaking with a veterinary medical professional and they say, hey, listen, it's going to be X number of dollars, as you mentioned, a financial commitment,
Yeah.
that's hard to do
Yep.
because you're thinking, you know, my dog is limping. But I spoke with pet parent down in Long Beach, and I just had this conversation with them, and I said, if we can intervene early, if we can get early intervention on an injury, then there's a high likelihood we can get your dog back to what you enjoy about your dog, right? So let's think, in my opinion, for that particular family in Long Beach, they love doing hikes. They love playing Frisbee. They love seeing their dog. There's something about that, right? That image of their dog racing across the beach, right? A full sprint, full gallop, chasing a ball into those waves. If we want to get back to that, we need to intervene early. And so my answer to you is, if your dog's knee is sliding all over the place because a ligament, one of the primary straps that holds that joint together, is torn, that joint is going to start making arthritis. Meaning, remember, Mother Nature's response to instability is arthritis. That joint is going to start making arthritis as early as 2 weeks in.
Wow.
And so what I always remind pet parents is, as a surgeon, I can do things to halt or slow the progression of osteoarthritis, but I can't turn back the clock. So if you come to me 8 months later with an ACL injury, I can't return that knee to the way it was 8 months ago, but I can hopefully preserve where it is now. So the short answer to your question is, I would say the majority of the time, if there's a dog who has an ACL injury, surgery is a likely scenario for that
Okay.
dog. Yeah.
Is there ever a situation where you've seen somebody with their dog and they decided not to get surgery, and you know the dog was able to, let's say, maintain a fairly healthy life afterwards?
Yeah, remember, for dogs and cats, movement is life.
Yeah.
Right? If you
Agreed.
or I were having a conversation, God forbid, you tear your ACL, I'd be like, Antonio, here's an iPad. You're going to be an accountant now, or you're going to be a host to an outstanding podcast, right? And you can sit down and just hang out, right? But for dogs and cats, movement is their life. I can't just put them in front of a tablet.
Yeah.
And so there are dogs who haven't had surgery, and if their lifestyle is couch potato, then they can be okay, right?
Okay.
There's also conversations about smaller dogs. Can we get away with not doing surgery in smaller dogs? I would just say all knees deserve care, regardless whether you're Yorkie or Great Dane,
Yeah.
right? All knees, deserve care. And so if you're a Yorkie and you're kind of getting around because, you're smaller, that doesn't mean you hurt any less. It
Fair
just
enough.
means you're smaller. And in orthopedics, size definitely matters.
Okay. Now, with that said, is there a certain age range that we could expect to see this, let's say in a younger dog or versus an older dog?
Between 4 and 7 is the most common, but unfortunately, I've seen some tough cases where you see juvenile cranial cruciate ligament injury. This is the conversation. Imagine how tough this conversation is to have. You have a brand new Mastiff at home. right? You bring your puppy home and you have to talk with that family and say, hey, listen, I know you have Rufus at home now, and he's a big old Mastiff, but he's 8 months old and he has tears of both of his ACLs or both of his CCLs in his knees, right? And that's it's like, how did this happen? Right? And it's genetics.
Okay.
So your dog has the genetics for this ACL to tear, and it could be an inciting cause like chasing a squirrel. It could be walking into the living room, right? I've seen dogs literally walking into the living room to get dinner and they tear their ACL. And then of course, later in life, it's less common in the sense of if your dogs get to be 9 or 10, I don't see as many injuries, CCL injuries, but I still do see them. 11-year-old or 12-year-old geriatric dog. He's just in his golden years. And then out of the blue, he tears his ACL or tears his CCL. So those are the challenges. I would say juvenile, middle age, and geriatric. And here's one other thing. I just want to bake your noodle with this. Toy breed dogs. If you've got a Yorkie or a Maltese or a Shih Tzu or a Lhasa Apso, they actually have found that those dogs tend to tear their ACLs later in life. And they develop less arthritis, and tearing the other knee is a little less common than if you were a large breed dog. So here's what I will say, just to put a period at the end of the sentence. Toy breed dogs and large breed dogs, when it comes to cranial cruciate ligament injuries, are, worlds apart.
Okay. Well, I'm glad to hear everything you're saying is tracking with what my vet told me. So my shepherd who passed last year, she actually tore her CCL. And I was really surprised. I actually originally thought that it had something to do with her hips.
Right.
I had gotten her hips checked and she was good to go. But, she was getting older and I'm thinking maybe she was a Frisbee dog. I'd throw her a Frisbee and I noticed that she started to limp after a day at the park. And, I was like, let me give her a break and it would get better. Yeah. She would get better. She'd start walking normally. So I would go back to the park and it would happen again. And this went on for, I would say, a couple of months. Finally got her checked out and it turns out she had a CCL tear. The thing is that the vet told me exactly what you said. He said, because it happened at 11, he said the fact that it happened at 11 is actually a good sign because it's less likely that it'll happen in her other knee. However, the common time frame is about 4 to 7. But what you're saying to me, that kind of, I'm not gonna lie, kind of bothers me a little bit, is the fact that it's genetic and it seems like there's not really much people can do about it. Is there lifestyle or diet changes to help prevent it? Because I'll be honest, it's like, I want to make sure that, because I want to get another dog soon and I want them to be a Frisbee dog just as well. So I want to make sure I do every single thing that I can to prevent that.
Well, if you're trying to prevent cranial cruciate ligament injuries, I will definitely be honest with you. There's not a lot you can do for prevention. Preventative orthopedics is tough, right? Because you can't change their genetics. But a few things that are absolutely essential is keeping them at a lean body weight. Now, a lot of people may roll their eyes and go, of course, right? But I will say this, there's a landmark lifetime study that they did in dogs. Purina did this study where they kept dogs who at a lean body weight, and those dogs developed less arthritis, they lived longer, and they had better quality of life than dogs who were fed as much as they wanted to and had higher body conditions. So here's what I will say definitively. We've got a lot of medications out there, right? A lot of supplements and a lot of different tools in our armamentarium. But I will say this, if I could bottle exercise and a lean body condition and put it in a bottle, it would be the #1 selling medication out there for pets.
I love that.
So I would absolutely say keep them lean, keep them in a great diet, and glucosamine chondroitin supplements are great. Omega-3 fatty acids are wonderful. They keep inflammation down. But at 100%, there's studies that really support exactly what you're saying. And then on top of that, there's a landmark study that looked at dogs who were referred to surgeons like me for hip problems. And it turned out that they had ACL tears, right? Or cranial cruciate ligament tears. So 100%, the difference between having a hip issue and having a knee issue is something we deal with all the time.
Okay.
Yeah.
And as far as the difference between our CCL and arthritis, what are some signs that people should bring their dog in if they're maybe experiencing arthritis?
Okay. Arthritis is that it's sort of silent limp where it's working in the background to cause pain and soreness and stiffness. And so you might see your dog after exercise, the next day they seem a little stiff. Or let's say they're lying down and they just took a nap. When they first get up, they're stiff and they almost have to warm out of it.
Okay.
What's happening there is the joint's angry. The joint's inflamed. And so there's so much fluid in that joint that now that they start to move, the fluid starts to move, and now they start to feel better. So if you are a pet parent or you're living in a multi-species family and you're seeing your pets, they seem stiff when they first get up and they have to warm out of it, they probably have knees like mine, right? And so that's why I say movement is medicine.
Okay,
if you are
love that.
treating osteoarthritis, not only keeping a lean body condition, but regular exercise and short exercise, 10-minute walks twice a day, 20-minute walks twice a day.
Okay. Now you mentioned inflammation. My mind automatically goes to diet.
I love the fact that you're bringing up diet because it kind of gets into the heart of what being a pet parent's all about, and to be an advocate for your pet. Because let's be honest, there's some people who wake up, they have coffee, a cigarette, and a donut for breakfast. You know what I mean? That's not great. Fortunately, we're not doing that for our pets. The majority of pet parents are so conscientious when it comes to diet, and it's important because that consistency in diet is wonderful. If you have your pet on a very good, well-balanced commercial diet, then excellent. If you're home cooking for your dog, make sure that you have talked with a board-certified veterinary nutritionist about that, because there's so many things that we might do at home that we think are a balanced diet that not the case for pets. For example, dogs produce their own vitamin C, right? So we don't need to add that, right? And there are different things that dogs need that simply people don't.
Gotcha. Now with the CCL tear, obviously we know that's a tear in the ligament.
Sure.
For arthritis, what exactly is happening in the body that's causing that discomfort?
Yeah. Okay. In arthritis, the joint is angry, right? The joint is there's something about the joint that's dysfunctional. So if there's a ligament that's torn inside the joint will release this cascade of inflammatory mediators. They release a cascade of signals to say, hey, stop using this joint. It hurts. And that's what gives you that pain, that swelling, that inflammation. And that's what gives our pets that limp, because the body is saying, stop using that joint. And so with that cascade of signals, it sends signals to the brain to say, hey, stop using it. And then here's the crazy thing. It'll actually make your joint more sensitive. So even normal activity, like, normal walking will be painful for them because of those signals. It's kind of like a sunburn, right?
Okay.
And let's say you've got a bad sunburn on your back. And I go, hey, Antonio, I slap you on your back, right? But it's not a hard slap, right?
Yep.
And you take the slap and you go, oh man, that really hurts. Was it the slap on the back that hurt? Or is it because your back is sunburned?
Gotcha.
That's why your back is so sensitive, is because it's sunburned. Same thing with the joint that's inflamed from osteoarthritis. It's not the normal walk that made the joint angry. It's not the playing with the ball that made the joint angry and inflamed and painful. It's the fact that the joint is on fire. It's like the joint is sunburned, it has arthritis, and just normal activity can make it really painful.
Okay.
Yeah.
Now my shepherd had arthritis. When the vet took x-rays, he walked me through and he pointed out something on the bone. There was a difference in the bone, and it looked to me like, I don't know, a little jagged.
Yeah.
Is that caused by arthritis over time, like the wearing of the bones?
What you're observing, or what you just commented on, is something we call osteophytes, otherwise known as bone spurs, right? And osteophytosis, or periarticular osteophytosis, all that means is bone spurs, right?
Okay.
And the joint has arthritis because of bone spurs. And the joint will make these bone spurs because it's trying to say, hey, listen, this joint is unstable. There's something wrong with it. So here's what I'm going to do. I'm going to make new bone. I'm going to make new bone, and that will fix everything. The problem is that new bone that Mother Nature makes, it's jagged, it's painful, it hurts, and that's what we call osteoarthritis.
I've been loving this conversation. We're going to jump into our Ask Me Anything
Okay, let's
portion.
do it.
We got
AMA.
we got some questions lined up.
I'm a little nervous for
don't
this.
be. You're going to crush it.
Be easy on me, man. Here we go.
All right, ready? All right. My cat Whiskers is 11, and I've noticed she's not grooming her back legs as much lately. Okay. She also seems stiff when she gets up from napping. Could this be arthritis?
Not grooming her back legs as well. Shout out to Whiskers. My heart goes out to that particular family because they're noticing something abnormal, and it throws off the whole family when Whiskers isn't doing well. So that notion of my cat used to be doing something normal, and now it's abnormal, or my cat's hair is unkempt, that could be a sign of discomfort, right?
Yep.
And that's a sign of, I don't want to groom that area because it's sore, right? And if they seem stiff getting up, that's also a classic sign. But I would say the number one sign in cats that they may be experiencing osteoarthritis. Antonio, can you guess what that might be in cats?
Not jumping.
Not jumping. My man. Oh,
Is that right?
You got to do that. Oh my goodness. Nailed it. Not the reluctance to jump is one of the key signs to osteoarthritis in cats, because cats love to jump on the countertop.
Yeah.
And if you have a cat who's not doing that. Now, clearly, cats can sleep up to 18 hours a day. So sometimes that's hard to detect. My cat seems to be sleeping more. And I say, you sure your cat's not just being a cat? Right. But now there's even fancier tools, right? There's activity monitors you can put on cats just to check their activity if your cat starts gaining weight. But all of these are great signs. The reluctance to jump, lack of grooming, stiffness when rising, sleeping more, and sometimes hiding or becoming a little bit cranky pants.
Yeah.
That can all be signs that, hey, I'm in pain and I'm just not telling you.
Got you. So bring them in and get them checked.
Absolutely.
All right, next one. My dog Bugsy had a CCL tear repaired 6 months ago and seems to be doing well, but I'm worried about his other leg. Is it common for dogs to tear the CCL in both legs, and what should I watch out for?
So if I see a dog and they unfortunately tear their cranial cruciate ligament, if I take an x-ray of the other knee and it has a bunch of fluid in it, the percentage that they're going to tear the other side goes significantly higher, right? And there's a variety of studies that have looked at this, but just in my population of dogs that I've seen, it's around 50%, and you don't know who's going to be in that 50%. And you say, well, can I prevent it on the other side? Remember, we just talked about the fact that this is genetics, right?
Yeah.
This is genetics. And so if your dog has a genetic predilection to tear their cranial cruciate ligament injury on one side, then the chances that they're going to tear the other are pretty likely.
All right. Some days my 10-year-old beagle Cooper seems fine. Other days he's slower on walks. How can I tell if he's experiencing a joint mobility problem or a CCL tear?
Well, I will certainly say beagles and chihuahuas, they seem to be, just in my experience, the longest living dogs that I've ever met. I have met more 19-year-old beagles and 21-year-old chihuahuas. I mean, just unbelievable.
The white faces.
Yeah, just all white faces. They're making it, you know what I mean? They're just powering through the day.
You're right.
True. It's like, how are you living so long? But 10 years old for a beagle is just getting started, right? They're just getting started with life. They're just warming up. And this is a very common sign for osteoarthritis, is that waxing and waning, that sometimes that good days and bad days, where you have a great day, right? So you do more activity, you run a little bit more, you walk a little bit more, but then you overdid it. So now the next day it's painful. You're stiff because you did too much. And so you get this sort of pattern where some days are good, some days are bad. If you are suspicious of osteoarthritis, of course, you know what I'm probably going to say. See your vet, right? If you're suspicious about a CCL injury or bilateral, meaning both knees are torn, the CCL, definitely see your vet. So if you're concerned about osteoarthritis, have your vet do a full body examination, feel the range of motion of the joints, feel if there's muscle atrophy, if the muscles are getting skinny, feel if they don't want to move their joints in the right way, if there's any instability or inappropriate sliding. But then if you're thinking about a CCL injury, have them do a very detailed orthopedic exam on the knees specifically, so that you know for sure if your dog has a CCL. And they may recommend x-rays at that time. Yeah.
Got it. Dr. Campbell, you are absolutely a wealth of information. Really appreciate all of your insights and all the recommendations you have to prevent arthritis and deal with CCL tears. Thank you so much for your time.
Man, this was outstanding, and what a wonderful conversation. And just remember, man, there is nothing stronger than the human-animal bond.
Love that.
Yeah.
Thanks again to Dr. Courtney Campbell for joining us on Care Experts to discuss arthritis and CCL surgery. And thanks to everyone tuning in. This episode was brought to you in partnership with Pumpkin Pet Insurance, helping make pet wellness care a walk in the park. The CareCredit credit card and Pumpkin Pet Insurance are better together, offering pet parents helpful financial solutions, including simplified claims reimbursement options. Whoa. Don't leave yet. I just want to say, if you want to hear more about health and pet care, check out these episodes of Care Experts. Also, before you go, make sure you hit that like and subscribe button. New episodes drop every Wednesday. You don't want to miss it.